My name is Allyson Kirkman. I am a med-surg clinical nurse educator. I have a really cool job. So when you think of a nurse educator, you automatically think school, academia. I take evidence-based practice and best practice standards and work with the interprofessional team and our clinical nurse specialists and other educators to educate our staff on the best ways to take care of our patients and ways to keep them safe. The information I teach our bedside nurses, that our whole team teaches our bedside nurses, is best practice. It's in the literature, it's evidence-based, and so what we teach our nurses to do and how to safely take care of our patients directly impacts quality. So length of stay, healthcare acquired infection rates, mortality. So it's very important. You know, right after that first wave of the pandemic, when everything kind of calmed down just a little bit, you know, our team, we had a command center. We were day in, day out. The information kept changing, just, you know, spitting out new information, updating materials, going and directly rounding on the departments. And I remember sitting in one of our little conference rooms afterwards, and we were kind of debriefing, and it was just kind of refreshing to hear, even though in the midst of such chaos and uncertainty and sadness in some instances, it was still refreshing to hear the impact our team made. Even though we weren't directly taking care of COVID-19 patients, we were helping our bedside nurses have the tools and the knowledge they needed to do so. And so when we ran those numbers and saw how many people accessed our iLearn site and how many hours we spent rounding, it was just incredible to realize you had that big of an accomplishment. At first, did not know I wanted to be a nurse. I knew I wanted to do something in healthcare. I just did not know in what capacity. And I remember as an undergrad, I registered for pre-nursing, and so you have all of the pre-nursing classes, and I figured, well, if I don't like it, I can just switch to something else. But once you got into those entry-level courses and you started understanding how a nurse functions and the education behind the practice, and it was just, it clicked. It's a different discipline. We get more time with our patients, I feel like, spend a little bit more time at the bedside, which is something that I enjoyed tremendously. I think it was the relationship piece of it that sold nursing to me. Someone who would be a good fit for this type of work is someone that enjoys learning. I learn something new every single day. You have to have a passion for helping people and developing those relationships. And you have to be a hard worker. It's hard, even at the bedside, whether you're a bedside nurse, a procedural nurse, even a nurse educator. It is a very fast-paced environment with a lot of changes, especially in the past few years. So you have to be adaptable and okay with change. As a clinical nurse educator, I think the spark for this type of position in particular started while I was still at the bedside. I think one of the most important things you can do as a bedside nurse, as a procedural nurse, ED nurse, you know, whatever type of nurse you are, if there's something, a career path, like whether it be education or whether you want to go back to school to be a nurse practitioner or a nurse anesthetist, try to spend time with people who already do the job. See if you can get a mentor. I have a wonderful mentor who was a clinical nurse educator when I was at the bedside, and by working closely with her, it kind of grew the passion for what I wanted to do as my career path as well. Nursing is a unique type of team, and it is a very unique type of friendship that you build with your colleagues. Just from my personal experience, both at the bedside and as an educator, I have had some of my best friends have been people I have met on the job. I mean, you are, with these folks a good majority of your time, and you're kind of all in the same boat. So it's, you understand what the other person may be going through. If you're having a hard day, you've been there. You know how to help in most cases. So the friendships are completely different, but they are some of the most wholesome, enjoyable friendships I've had.